I'm Krista Wood, and I'm the Executive Director of Heartland Cares in Paducah, Kentucky, and we're a full-service HIV and AIDS program. And today I'd like to welcome you to our first series of HIV 101. And today we're going to be talking about prevention. So I have with me today two seasoned prevention specialists, Shane Burkeen and Terry Stalions. So I really appreciate y'all being here today to help us understand a little bit about how to prevent HIV.
Thanks.
So how long have you been working at Heartland Cares?
Well, it'll be my 5th anniversary in August.
Wow.
So I've been there 8 years in October.
So when I said seasoned, I really meant that, didn't I?
Yeah. Definitely.
And with that seasoning comes a lot of really good expertise, and that's why I've invited you here today so that we can talk about that expertise and maybe help the audience understand a little bit more about HIV, because at Heartland Cares, we feel like it's our responsibility to protect the community in every way that could put people at risk for HIV. And I think one of the things that amazes me is how many different prevention messages we have to have out there to be able to do that. It is just unbelievable, because it's not just about HIV, is it?
No, it's about lots of different STDs and other things too. Well, and with HIV, the way it itself evolves, we have to evolve with our prevention message. And you know, when I started 5 years ago, it was a different target population than it is now. So you know, we're always looking for fresh new ideas, new ways to target HIV in different communities. It's just ever changing, ever evolving.
Wow, that is so true. That's really true. What other, we talk about HIV, and we can talk about some risk factors in a minute, but what else are we really talking about when we're talking about prevention? You talked about STDs. Terry, can you elaborate a little bit about that?
Well, and we're really just talking about how to help the community. You said we feel like it's our duty to protect the community, but the way we're going to do that is to teach the community how to protect themselves, because you only get one body and you're the master of that body. So you know, our message is kind of teaching you how to protect that body and make the right decisions to protect it, and not count on somebody else to do that for you.
Sure, and we always take the approach of universal precautions. You know, you are responsible for your body. You know, you want to take universal precautions, and I used to be a phlebotomist before I came to this job, so universal precautions was always a big part of my life. And you know, you glove up, you know, you protect yourself, you wash your hands, all that stuff, and all of these are great things that we can do to protect our own bodies from risk of HIV and STDs. I think a big role in prevention, one of the biggest things, especially in a rural area, is education. We're so very uneducated about these diseases that, you know, I think that's our biggest, you know, stumbling block with prevention.
I think the community even will agree with that. I know most of the places that we go to speak, if you go and say, well, we're here to talk about HIV, 8 years ago the message I might get was, oh my gosh, why are we going to talk about that? But now the message you get is, you know I don't have the right information about that. The information I've got is really out of date. So I know I don't have the right information about it. So people are aware that things have changed about it, but they don't really know what they are. And they don't know that, you know, it's not just HIV, but there's other STDs and hepatitis C. Everybody's afraid of HIV when there's lots of other things out there that you really want to protect yourself about instead of just HIV. HIV might be the least of your worries in a certain situation, but that's the one everybody's concerned about.
Okay, well, let's talk about those then. Let's talk about HIV, and let's talk about STDs, and let's talk about hepatitis. And let's talk about how to raise awareness and do some good education, so that, because I agree, you know, education is the key.
Right.
And when you said that, you know, 8 years ago or 5 years ago it was a lot different than it is now, I guess I'd like to think that's because y'all are out there doing good prevention messages. And
well, we like to think that too.
well, and we have a lot of help with that. You know, we have Channel 2 helping us do public access on a regular basis anytime we want to be able to get that message out, and we really appreciate that. We're a United Way agency, and you know, they've supported us, and they help us get that message out, and then we collaborate with, you know, different programs And we also are always willing to do health fairs and public speaking, working with colleges, working with schools to be able to get that message out.
Right. So our motto is we'll go anywhere where people will listen. So anywhere people will have us, that's where we'll go and we'll go and talk.
That's a great motto.
And we'll come at it from whatever angle you feel the most comfortable with us coming at it from. If absence is that where you feel like we need to start, then that's where we're going to start. We're going to come in and listen to you. It's a client-centered approach. So we're going to listen to you and what your needs are, and we're going to approach all this from that angle. At the same time, we're going to try to educate and explain to people, you know, sometimes we go to places and they're like, well, I don't want you to talk about sex. And we're like, well, you know, you get HIV from sex, so it's going to be really hard for that not to come up. But we're going to talk with you about where that's going to come into play.
So what I'm hearing you say is that anyone who would like for you to come and speak and educate and do a prevention message, you will kind of customize the program to their comfort level.
Sure.
Definitely. Our clinic uses a harm reduction model, which is basically we throw a buffet of options out to the person, but we meet them where they are. And we find that's, for our system, that is the best way to make a behavior change, is to meet them where they are. So if a school says, you know, I don't want you to teach anything but abstinence, you know, that's fine. You know, abstinence is 100% the only way you cannot catch HIV, you know.
Right. Those ABCs, with A being abstinent.
Yeah, and we do believe that. Now, do we think that's practical in the real world? Maybe not. But, you know, that is part of our buffet that we throw out, so.
Okay, that's great. So when we talk about a prevention message, like to the community at large, because I know you all work with risk groups as well, but if we're working with the community at large, I can remember quite a few years ago they came up with the ABCs of HIV, and you kind of reminded me of that, Shane, when you said, you know, abstinence. What are the ABCs for the community to think about if we're, you know, abstinence is the only sure way that we can guarantee that HIV is not going to be spread? What's the B?
Be sure to know your status.
Okay, good. And then what about C?
C is to use condoms.
Okay.
If you're not sure and you're not comfortable with what's going on, then you want to be sure that you protect yourself, as we were saying before. And you want to count on yourself to use that protection. You don't want to count on the other person. If condoms are going to be whatever's going to be part of your safer sex program, then you need to be able to stand up for that and say, no, this is what I'm going to do, and not let the other person make those decisions for you.
Okay, now y'all said a bunch of stuff that I want to dissect.
Okay.
Are you okay with that? Because this is great, because you said the word status. And you know, for some people status is what kind of job do you have, or you know, how old are you, or what clubs you're in, or you know, what office you hold in that club, or whether you're a deacon in the church. You know, it's a status. So how does it, what are you talking about with status with HIV?
Sure. Well, in our line of work, there's 3 different statuses you can have, actually. Status is HIV positive, HIV negative, and unknown. And I would say, you know, probably a third of the community at large is unknown about their status, if not more. And that basically means they haven't received an HIV test. There's a lot of misconceptions around when you're given an HIV test. A lot of people think if they go to the doctor and their blood is drawn, oh, well, they must have, you know, given me an HIV test. Why wouldn't they? A lot of people think that whenever they go and give blood at a blood fair, you know, say the Red Cross or something, more than likely they are going to test you for HIV, but they may not contact you for those results. You know, when a lady is pregnant, going back to my phlebotomy roots, you know, I had to draw these tests, and a lot of the women did not know that they were being tested for HIV. There is a waiver form that they have to sign, but it's slipped in a bunch of other forms. So, you know, they don't really, you know, they're just signing off, and they don't really know what they're getting their blood drawn for.
And that comes from a lot of discomfort even in the medical community. In a small rural area like this, even medical professionals are uncomfortable suggesting to a pregnant person or anyone, you know, do you need to get an HIV test? When we kind of look at it as, you know, this is 2008 and it's part of your standard health practice, everyone should get an HIV test. But in a rural area like this, doctors are still, you know, I don't want to insult this lady, so they're very uncomfortable. So sometimes they will just slip those papers in, thinking, okay, well, we'll just sign that and that won't be any big problem.
Yeah.
Well, could that have anything to do with maybe some stereotyping of what that woman looks like
Sure.
and where that woman comes from
Sure.
and what their comfort level is? Like they may go to the country club and play golf with the husband, and so to ask that woman, you know, we need
It
to
would
give
be insulting. Some people would consider it to be insulting to ask someone what their HIV status is. That's insinuating that you're that kind of person or that you might engage in this kind of activity. When, you know, this is 2008. It's a general health concern. Everyone should know their HIV status. And if you're pregnant, then that means you've had a risky behavior, even though you may be in a monogamous relationship.
That's a very good point.
You still want to make sure for the health of your baby, as well as for your own health. You want, you know, to have that healthy baby, we've got to have a healthy mom. So knowing your HIV status would be a very important part of maintaining that health.
And this is something we also talk to about to teenagers that maybe make a promise to remain celibate until they're married. You know, you may know that your body does not have HIV, but you know, it is a promise to have sex with a person one day, and you don't know exactly what your partner has. You know, your partner may tell you, I'm clean. I'm clean. Clean basically means that they do not have the HIV virus in their body. But you know, people lie. You know, and it's not that you should not trust everybody, but you know, be cautious with your body. Like Terry said, you know, you only get one body in this lifetime.
Well, and people lie for different reasons. There's a lot of discomfort around disclosing your HIV status. You can't just expect someone in rural Western Kentucky to say, "Now I have HIV." You know, that's going to be a hard thing for someone to say to someone. People with HIV are concerned that they're going to lose their partner, they're going to lose their family,
Their job.
or their job. So you know, you're going to
Charge.
have to work on how this person's going to tell you their HIV status. You can't just expect someone to say, "Oh, I have HIV."
But you know, you said something earlier about the unknown, or I think you did, when you were saying there were status meant three different things, and one of those was unknown. And so those are people who haven't tested. And do they test because they may have some symptoms or they may have some risky behaviors and they're afraid to test, or do they not test because they don't have any symptoms and they don't think that they have the disease, they don't have any reason to test?
There's so many things attached to not getting a test. A lot of people still think that from the early 80s, like I said, you know, how HIV's changed over the years. In the early 80s, it was thought to be a white gay man's disease. And so a person may not fit into that category, so they're like, you know, I don't have to get tested, I don't fit in that category. A person may have got a test once in their life and they just think that they're negative or whatever forever. And another stigma also is I don't want to deal with knowing that. If I don't know my status, then I can say negative to everyone and then I don't have to deal with it. I know a lot of my friends that I try to get tested, you know, I try to bring this message with me everywhere into my life, and they just refuse to be tested. They'd rather, they say they'd rather commit suicide than know. You know, and you try so hard to tell people that, you know, HIV isn't a death sentence anymore like it used to be, but people just don't want to hear that right now. So you meet them where they are, you know, you try to offer them other solutions and, you know, go from there.
So when we say know your status, that's where that slogan comes from, because there's people who, for a lot of different reasons, don't know their status. And a good prevention message is to get a test, and know your status.
And know that knowing your status doesn't mean announcing it to the world. The first thing you want to do is know your status. You know, then you are in charge of what you're going to do with that, because now you know what your risk is to someone else, you know what other people's risk is to you, because if you have HIV, that's going to make it easier for you to get all these other STDs and other infections because your immune system has been compromised. So it's important for you, the positive person, just as it is for the negative person. So it's important for both of you to know your status. And now you can start to decide, you know, what am I going to do with this information? It's not like, okay, now I know I'm positive, I have to announce it to anybody and everybody I come into contact with. You know, and that's part of what we do in prevention, is to help people make those decisions. Who are you going to tell? How are you going to tell them? When are you going to tell them? Under what circumstances are you going to tell them? And
we still test at the clinic, that, if I understand correctly, anonymously.
Of course.
And so what does an anonymous test mean versus a confidential test?
Anonymous basically means that the tester might get your name, and that's totally up to you. When you come in for a test at our clinic, normally the tester will introduce themselves, and it's your choice whether you introduce yourself or not. If you do give them your name, then the tester would immediately say, okay, this is now an anonymous test. I and only people that are privy to this information will see this information. It will not be told, it will not be posted on a billboard somewhere. There won't be, if the results come back positive, you won't be put on a list for,
And your name doesn't go with the test. If it's
Okay.
anonymous, whatever name you give me, you can say your name is Mickey Mouse. Then I'm going to put Mickey Mouse on the test.
And so what about my social security number?
No, we don't take any. All we take is your name, whatever name you give me.
Okay.
That means it's anonymous, because only I or whoever's in the testing room, that's the only people that are going to know that it's you and your test.
Okay.
If
And
it's
then at what
anonymous.
point would that test, how long does that test stay anonymous?
It stays anonymous forever until you come into care. Now, if you go and get your confirmatory test, and then you decide to come into care at the clinic, at some point you're going to have to switch over to confidential, and depending on what agency you're at and how
But
that
only
works.
if you're positive. Now,
If
we're
you're-
talking
if
about
you're-
positive.
if your
As long
test-
as you stay
right.
negative, you stay anonymous forever?
Right. If
Is
that's
that
what
correct?
you want to do, that's right.
Okay.
And the same thing with positive. When that test comes back, if it comes back positive, it's still in your hands. You have to decide what you're going to do with that.
Okay.
Okay. Now, if you get it tested through LabCorp or something like that, then there's you may go through surveillance or something, where they might contact you about sex partners and things like that. But that's something we, the prevention team, help you to deal with. But it's still anonymous until you decide that it's going to be confidential.
Now, Terry, I don't want to forget to talk more about testing, because I think that's really important. And
Okay.
I know you also are certified to teach pre- and post-test counseling and
Right.
train people how to actually give tests.
Right.
So I think that's really important. But I still have, y'all still opened up all these questions
Okay.
that I want to talk about first before we talk about that, if that's okay
Definitely.
with you.
Sure.
I know that you said about, I still am going back to this unknown, your status being unknown. And I know what I've heard and what I teach is that you have different sexually transmitted diseases such as HIV, such as STDs, such as hepatitis, that is asymptomatic. Is that the right word?
Right.
And so they can stay in your system, but you not have symptoms. Is that right? And for how long? And what does that mean?
And what people confuse is when you become infected with an STD, like hepatitis C or HIV, and when you find out that you have it. And that period of time is when you're talking about being asymptomatic, because until you get tested or until you get sick or you get symptoms at the emergency room, you don't know you've got it, but it's still there. Because people will come in and get an HIV test and we'll tell them it's negative, and they're like, now I heard this can lie dormant in my body, so when do I need to get tested again? Well, you found out. You're finding out that it is not there. Okay, so up until that date, it's not there, depending on the window period, which we'll talk about a little bit later.
Okay.
But you're asymptomatic, meaning that if it was positive, you may feel fine, but now you know it's there.
So asymptomatic means without symptoms of the disease.
Right.
Correct.
Right.
And HIV affects people differently because everyone has a different immune system, and sometimes there are symptoms to HIV, symptoms that people say are associated with HIVs, like night sweats, lymph nodes swelling up, flu-like symptoms, and all that. Not everybody that
I've experienced that before.
Yeah, not everybody that has all those symptoms has HIV. We don't want to scare people, but those are common symptoms whenever someone seroconverts is the technical word for it.
Seroconverts.
Yeah, whenever they go from a negative status to a positive status. So, but yeah, some people never experience those symptoms, so they don't think they need a test.
So how long? How long can someone be asymptomatic or without symptoms?
Well, you could go on for years. You could go, 5 years, 8 years. It's really an individual thing, person to person. But you could go as long as, you could go no telling how long. But eventually, your immune system is going to become so compromised that that you'll start getting colds a lot, and you'll catch every little infection or something that comes along,
or something very strange.
Something's going to put you in the emergency room, which unfortunately is how we get most of our clients at Heartland Cares. We get most of them from the emergency room, or from women who find out they're pregnant, because people are still not comfortable really around here knowing what their status is. So here we find we have all these people coming in from the emergency room because they're sick and we can't quite figure out what's wrong with them, and somewhere while they're in the emergency room the doctor says, well, let's give you an HIV test, and there you find out you're positive, and you've got all these other things going on, when, you know, if you get a test all those years before, then you know and you can stay healthy.
I think that is a really important message, because I know that people who come in from the hospital, they've already gone from an HIV diagnosis a lot of the times to an AIDS diagnosis, and then I know from a health standpoint, which is going to be one of our future segments, is to talk about what it's like to live with HIV and what the complications are, and how important it is if we can keep it at HIV instead of going into an AIDS diagnosis. So,
well, and I think that's one of the most amazing things about how far HIV care has come in the last several years, is that, you know, people can come from the hospital and be so sick, and then medication and doctor's visits in 6 months, and, you know, you're back at your life, and the, you know, the potential is there for you to make a full recovery. So even when you're that sick, you can still, you know, recover and go on with your life. But don't get there. You know, don't wait till then. Come in while you're still healthy.
But
and
doesn't
find
that
out.
really just tell us that it has nothing to do with the illness anymore, because the illness is manageable? It has to do with the stigma. And you know, you've said a little bit about rural area, you know, Paducah being a rural area, and we don't just cover Paducah, we cover, what, 42 counties? And then we also, with CARE and collaborate with Prevention in Southern Illinois. So we have a pretty big service area, and Paducah is one of the largest areas in that service area. You know, there's a few cities like Hopkinsville and Bowling Green that are a little bit bigger than the city of Paducah. But other than that, basically, we have a lot of countryside there. And so what does all of that mean? What does that stigma mean?
Well, there's still lots of old beliefs about HIV and what it means, and, you know, and what if it's true? What if I am what if I do fit in one of those categories, and I live here in, you know, I live in Burkeen, Kentucky. You know, I can't go out and get a test. People will find out the truth about me, so people don't get a test. So
or my Aunt Susie works at the health department, and I can't see Aunt Susie there. So I go to my doctor, and my doctor's going to charge me $175 for a test. You know, to go to your family doctor, you know, who may also be someone you very much love and trust and go to church with or something like that, you know, it's very hard.
Well,
it's expensive, and
you know, my doctor, my whole childhood was my uncle. Like, I'm going to go to my uncle and say, "Can I have an HIV test?"
That is small town.
So people just aren't going to do that. I know it's sad, but 8 years ago, you know, people are still saying the general rule was, if you really thought you need an HIV test, you need to go 2 states away, so no one would find out about it, because, you know, you didn't want anybody to know what you had been up to.
Well, and then the chances of them getting their results, because before we weren't lucky enough to have a rapid test where you could get your results in 20 minutes. You know, if you go 2 states away and get your test, you have to wait 2 weeks for the results. You know, are you going to have time, or are you going to forget about it, or
are you going to go back?
Right.
And so there's another question now: rapid test.
Rapid test.
What is a rapid test? It's almost like a rabid dog. Rapid test. What's that?
Well, there's 3 different testing options at Heartland Cares that we offer. And one of them is the rapid test. It's a 20-minute test. It's called an OraQuick. And it's a very quick test. I mean, it's just like its name.
Are they going to stick me with a needle?
Well, unfortunately, no. No, actually, it's a very, very easy test, and people tend to love it when we offer them that option. But it's an oral test. It's a swab that you take. It has a cotton end on it, and you swab it on your gum line. And what it's doing is, Terry's so good at
it's drawing the serum from the cells in your gums, which is where your body stores antibodies. And it measures it stores it in the cells in your gums.
Wow.
And so it's checking to see if your body's making antibodies specific to fighting HIV infection. Anytime your body gets an infection, it makes an antibody to fight that infection. It's the same way with HIV. And all of our tests do that. They all measure to see if you're making that antibody. Both the oral test and the blood test. That's what they all do. So the blood test is not any different from the oral test. It's still measuring antibodies.
And so if I came in to get a test, what kind of time frame am I talking about?
Well, depending on which option you choose, the Aura Quick, which is you would find out a preliminarily positive, a negative, and a inconclusive result that day in 20 minutes.
20 minutes?
20 minutes.
Okay,
yes.
so I could come in and in 20 minutes I'd know something.
Right, right. So it gets a little sketchy with the preliminarily positive. It's a screening test for negatives. We know 100% that it's
a negative's a negative.
A negative is a negative.
Okay.
Now, if the test were to come back inconclusive, it would just basically mean we needed to retest you. Something's wrong with the test kit. It has a backup in the test to actually let you know that that's how advanced it is. And then you can also get back a preliminarily positive result, which would mean that you were HIV positive necessarily. We would go ahead and talk to you about your options, care options, how you're feeling, social group options, you know, who you'd want to tell, who you'd want to, you know, help support you in this, and we just, you know, offer as many things as we could.
Okay.
But that is all associated with the 20-minute test, the Aura Quick test.
And so if it came up a preliminary confirmatory, is that what you said?
A reactive.
A reactive, thank you. If it came up a preliminary reactive, then how would I know whether that reactive, does that mean I'm positive if it comes up reactive?
We're going to prepare you for the worst.
Okay.
Just because we feel like it's a very good way to educate a person.
Okay.
And we're going to prepare you for the worst and talk to you about all of your options if you are.
So what are you going to do if this is positive?
Yeah, what are you going to do if this is positive?
And we're going to do that anyway. During the 20 minutes, we're going to help you come up with a risk reduction plan. We're going to help you identify some safer goal behaviors. And we're going to help you come up with an action plan as to how you're going to make all that happen. And all that's going to affect what you're going to do, even if the test is reactive or if it's negative. Because we're going to point out to them, you know, you've got a good plan here to reduce your risk, and now that you know that you might have HIV too, this same plan is going to help you keep from infecting other people. And remember, now it's important for you not to infect other people, and it's important for you to know that it's going to be easier for you to catch other STDs and things from those other people.
Right.
So we kind of do all that before the 20 minutes, because at the end of the 20 minutes they're going to hear they're only going to hear one thing, and that's negative, or they're going to be listening for positive, so you have to explain what the reactive is. And so then you just have to kind of redirect them back to say, and remember, here's your plan, and we're going to go on with this plan, and now this means you need to go get a confirmatory test too.
And so the confirmatory test, you say go and get a confirmatory test. So where do you go get that confirmatory test?
Right. Well, there's a couple of ways to get a confirmatory test. You can go to LabCorp, and we'll give you a lab sheet, and they'll go down to LabCorp and draw your blood.
For free.
For free?
For free, that's all. That's all part of it. And that takes about a week to get that results back. And then the other way you can do it is we can do the other oral test, which you didn't get to explain. I'm sorry, I'm jumping in here on you.
No.
The other oral test is called an OraSure test, and it's a confirmatory test. They're confirmatory tests because we have to send them off to a lab where they're going to run the ELISA and the Western blot on them. So they're going to do both of the confirmatory tests on it. So again, that also takes about a week to come back. So we're going to counsel you on what you're going to do during this week, and if you're going to be okay.
It's going to be a long week.
Who you can talk to, and you can talk to. We'll usually make plans for them to check in with us, and we ask if it's okay to check in on them. And
normally we offer them our phone numbers, prevention. We have cell phones. We normally offer it to them to give us a call night and day, whatever they're comfortable with, you know. Because we know that first week is a very hard week on them, and that's where a lot of where we can come in and make this easier for them. You know, if they have any questions, to answer them then instead of them making a bad move.
So what you're telling me is that they're not alone, and that you're there with them, and so you kind of advocate for.
Definitely.
What about if they
advocate and support? I would say.
Go ahead and explain that.
Well, because most of the people that we ask when they have a reactive test, you know, who are you going to talk to about this? Almost all of them say nobody.
Right.
So they don't have anybody they're going to go talk to, even though we try to help them identify someone. Usually they don't feel comfortable telling anyone. So that leaves whoever tested them to be their support system for the next week or until this result comes back. So that's why we kind of set up this kind of time frame to check in, because people will find, you know, when they find out the reactive, the first thing they really kind of want to do is get out of there and maybe pretend this didn't happen. But then, you know, the next day or the next one, about 2 or 3 o'clock in the morning, they're going to have questions. So then they're kind of glad they've got that number so they can
And
call you
so
back
we've
and
got
check with you.
a reactive, and then we've got a confirmatory. So
Right.
reactive is always going to be followed up with a confirmatory test.
That's right.
Correct.
And then if that confirmatory test is positive and they choose to come into care, say at Heartland Cares, is that where your role stops? Do you just turn them over to someone else, or after, what happens then?
We can actually enroll them in a program called PCM, which is Prevention Case Management.
Oh, okay.
It's an intensive one-on-one counseling session talking about risk factors, risk reduction behaviors, or even just a social, you know, just talking them friend to friend. You know, you're here now, what are we going to do? You know, what are we going to do together? Because we would never, ever let someone be alone in this, you know.
And so if I had to go to the doctor with a positive test and I was afraid to go alone and I didn't have a family member who I wanted to disclose or trust, I could count on one of you all to kind of hold my hand through that?
Sure.
Definitely, definitely.
And you would have a female maybe if I wasn't quite comfortable with a male?
Sure.
You
So we'll
would?
find somebody that will go with you.
Yeah. Yeah, we always try it. I mean, we have a lot of different ranges of people that we can send with.
And not just to go with you to the doctor, but to help you figure out how you're going to tell these other people, if you're going to tell them, who you're going to go with you to tell them.
So do you have to tell?
No, who you tell and when you tell is up to you. And then we educate about safer sex and what risk factors are, how you can spread HIV, and we help them to understand that, you know, these are the issues at which you're going to be putting yourself and someone else at risk. So these are things you want to be sure you consider. But just talking to your family or your work or things like that, you're not obligated to tell anyone your HIV status.
Now, Terry, just what you said there, is that what you were talking about earlier when you said a risk reduction plan, or is that something different?
Now, a risk reduction plan is you came in today to get an HIV test because something has happened in your past where you're worried that you might have been exposed to HIV. So we're going to sit down, we're going to identify what that is, and then we're going to help you figure out a way that you can reduce the possibility of doing that again. So that you'll make a risk reduction plan. So your safer goal might be, I'm going to have safe sex from now on. Okay, that's my goal.
And safe sex is what?
Safe sex is I'm going to use a condom every time I have sex.
Okay.
Because I've come in today because I had sex without a condom and now I'm really worried about my status. So my
Okay.
goal is I want to use a condom every time. So then we're going to make a risk reduction plan, which is going to be, okay, I want to use a condom every time, and how am I going to go about doing that? Where am I going to get them? How am I going to have them with them? How am I going to bring up the subject of using this with my partner who now wants to know why suddenly do I want to use a condom? So we kind of, that's our action plan, where we kind of figure out how we're going to do all this.
Okay. And then that risk reduction plan, what if that risk reduction plan was that I'm really concerned about having sex? Is
Okay.
there a risk reduction plan that is for people who say, you know, well, I'm not going to have sex right now, but it doesn't mean I'm not going to have a relationship, and so what do I do with all that?
Sure. Well, then that's going to, because the risk reduction plan is specific to each person. So if you as a person come in and say, no, I'm not going to have sex right now, then we're going to talk about, okay, well, that's a good risk reduction plan because you're not going to have any risk, because you're not going to come into contact with any fluids. So if there, so I think I hear you saying we're going to talk about someday when I do want to do that, then we're going to talk about how you can talk to your partner about your concerns about HIV or rather STDs, and how you can talk about your concerns about, you know, do we both need to get tested? Maybe we could go get tested together, or maybe I want you to use protection, and you can kind of plan for when that's going to happen.
Well, and I guess for me, what I would want to know is that there's a lot of things that can take place in an intimate relationship or in a casual sexual relationship.
Okay.
And is there some kind of formula that I can go by?
Sorry, there's not a formula.
But
No,
I mean,
because
isn't there
it's,
like A, B, C, D, E, F, G from like, you know, this is going to be my least concern, you know, because when you keep telling me, I'm hearing you all say, you've come in here because you've had a risky behavior, and then
Okay.
you tell me about a condom, and so I'm thinking the only risky behavior
Sex.
is intercourse.
Oh, okay.
And so, but I know that there's a lot of other things that take place, and I know that
Well,
there's a lot.
Sure.
Sex is a
what-
big word. There's lots of different activities that fall under the word sex, and there's all those activities. Some of them are less risky for getting HIV than than others of them.
And so is that part of your harm reduction
Right, yeah.
model, is
Yeah.
helping people understand what each one of these behaviors
Sure.
are and what they can
Sure.
do? Because I know that we've got a pamphlet at work that I think is really good. You talked about abstinence, and we've talked about teens a little bit. We haven't talked about how teens is a pretty fast-growing population. Is that
largest.
correct?
Yeah.
The,
According to
lar-
Center
the
for Disease
largest,
Control.
the largest
The largest
population,
population.
and
13 to
we even
24.
actually have a youth action group that we're going to have in one of our future shows
And
as
they're
far as youth. But we have a pamphlet that's 101 ways to
be intimate without
to be
having
intimate
sex.
without having sex.
Mhm.
I
Okay.
think that's a very, and so I'm thinking of those 101 ways of being, these are behaviors that aren't going to put you at risk, but you can have an intimate relationship. So we may be saying don't do this, or if you do this you're going to have to do it differently if you don't want to catch something or spread something. But there's some other things that you can do as well, because I know that sometimes youth maybe are put in a situation where they've crossed that boundary, but then they
Right.
want to go back across.
Right.
And so there's some ways that if they're going to take that away from themselves, what can I do instead? Do you all talk about that and teach that?
Well, you know, and we haven't even touched on the whole other side of how you can catch HIV is through drug use.
Okay,
You
good.
know, I mean, that's part of a risk reduction plan also.
Yes, thank you.
Is planning to use drugs safely. Yeah, I mean, there's kind of a formula. HIV is one of the hardest things in the world to catch, but it's one of the easiest things in the world to catch. It's so random that you just kind of really want to be careful, you know, is what we say. But there's kind of a formula, you know, of which is the riskiest behaviors and which are less risky.
So like kissing.
Kissing would fall under the less risky behavior.
Is it
Yeah.
the least risky behavior?
I would say
Well,
yes.
the least risky thing you can do is be absent.
Yeah.
Okay,
you
then
won't
that
get
means
it.
no
And that's
kissing.
abstinent from sex, and that's abstinence from drug use.
Yeah.
Okay.
Anything that involves an injecting needle.
And honestly, we need to get to the roots of HIV. HIV is found in 4 different body fluids, which
Okay.
is blood, semen, vaginal fluid, and breast milk from a positive mother. So these 4 fluids, if you come into contact with any of those fluids, then that puts you at risk for HIV.
So it's not in
possibly.
sweat?
It's not in sweat. Well,
No, it's not in sweat.
I can't, you know, the whole thing about mosquitoes. Let's talk about mosquitoes.
Okay.
Can
Sure.
I get HIV from a mosquito? Because I know when a mosquito bites me and I slap it, there's always blood.
Okay.
And so if they've bitten someone else and then they've bitten me, or then if I don't slap them in time, they might go bite someone else. And somewhere along that chain, someone could be infected with something. What am I going to get from that mosquito?
You can't get HIV from a mosquito bite because mosquitoes use blood for food, and once HIV reaches the stomach, then it's digested and it's not HIV anymore. So it's just
Okay.
food. Also, a mosquito doesn't inject stuff into your skin; it pulls stuff out. So it's not going to inject someone else's blood into your skin.
Okay.
And if there is blood on that mosquito, HIV doesn't like the air. So HIV can only live in the air that you've argued anywhere from 30 seconds to a minute. So it's going to have to get out of someone with HIV's arm pretty fast and get over to your arm to get in, and it's not going to inject it anyway. But HIV isn't going to be alive in that blood because it doesn't live long enough when the air gets to it.
Well, and people, I know I get bit by a lot of mosquitoes in the summer. I would think that we would have even more. I mean, it is a pandemic
Well, sure, and
as
people
far
worry
as
about
the
that.
disease. And so I would think that we would all probably, it would be a plague and we'd all be dead if it was
Right.
from mosquitoes. So,
Right.
but I know that I think that's important if we're talking about education, is what does and what doesn't cause
definitely.
HIV. And how many people are infected in the United States with HIV?
Well, numbers that we get from surveys really aren't reliable because I know there's a famous saying, for every one person that we know that has HIV, there's 2 others
Okay.
that don't know their status. But
Okay.
roughly, we think from statistics from the CDC that there is about 1 million people in the United States with HIV.
Okay. And it seems like I read that it's 40,000 plus new diagnosis a year. Is that correct?
Right.
So that's
Right.
you know, that's a pandemic, and then
Right.
you know, that's just in the United States, and we're not even going to get into worldwide right now because we're going to try to do what we can for our community and
Sure.
prevention.
Well, and that's a good point, because another myth about a rural area like this is, okay, well, there might be 40,000 infections a year, but not around here.
Not
Who around
here.
here has
That's
HIV?
All, that's all in Africa.
Right,
Yeah.
it's all, or it's in San Francisco or New York, or
Right.
it's in some big city. People don't want to think that there's HIV, you know, right here in rural Western Kentucky.
Oh, I agree with that so much, because I know I've worked at Heartland Cares for 9 years now, and I was on the board before that. And when people ask me what I do, you know, there's this pregnant pause first, and then they kind of step back, and then usually the first thing that they say is where is that? Is that in Paducah? You know, and then, do we have HIV in Paducah? And then they are trying, you can tell they're trying to figure out, why would I want to work in a place like that? I must have HIV. And
Right.
then, then it's like the curiosity gets the best of them. And so then they start asking me a lot of questions, which I'm always appreciative of. And you know, I'm a psychologist, so I enjoy watching body language and human behavior, but it is so consistent.
Sure.
It is so consistent. And I mean, even my mother, and I know she's going to watch this show, but it took her forever to even tell people what I did for a living. And I'm so proud of her, because now she says it proudly.
Sure.
But before it was like, you know, oh, I don't even want to tell people what she does. And that's that stigma, you know, and I understood it. I always thought it was kind of cute. But you know, I always think, well, you know, that's part of that education. We've got to educate people, our family members. And I think that's one of the things I would like to put out to the community is, you know, when was the last time you talked to your family members or your friends or people at work about, you know, what about HIV? Do you know that we have a clinic in Paducah and we have over 300 people, you know, who are receiving care there? And those are just people who are receiving care in Paducah. A lot of people go someplace else for that stigma that y'all were talking about.
Sure.
And that since we've been open, we've treated over 600 people.
Exactly. And they've moved away, or you know, they've
places.
So.
And you know, and I am proud to say that, you know, my mother, she works at an elementary school, and they actually train the teachers. They say there are some students who cannot name their names that are HIV infected in our school system, and you know, use universal precautions. And I really think that that's, you know, such a great step forward. You know,
so different from Ryan White, isn't it?
Yeah, definitely. Definitely.
When it's still, you know, we talked earlier that youth are the largest category identified by the Center for Disease Control that are at risk, but they're the hardest group for us to reach in this area. So, you know, not all schools are like that school.
Definitely.
That's something schools are really nervous about touching, which makes our youth action group so valuable, because they're students in these schools, so they can go to the officials and say, you know, we want to know about this. It's not somebody, you know, some clinic coming in from the outside saying, we want to come and talk to your kids about sex, which is kind of the way they look at it. You know, these kids are there and they say, hey, we want this information, and so that makes it a little bit easier to get in.
Yes, definitely. There's a couple of things I want to make sure we touch on before we run out of time. And you started talking about, you know, drug behavior being at risk. So I want to talk about drug behavior. I want to talk about STDs, and I want to talk about hepatitis. So that's a big menu, but it is, to me, those are especially things that put us at risk. When we talk about, you talked about injecting drug use, but what about drugs in general putting us at risk?
Sure. Well, injecting drug use was categorized by the CDC as one of the easiest ways of getting HIV.
That's at the bottom of that list, where, you know, abstinence is the top of the list. Injecting drug use would be at the bottom as the most risky way.
Injecting drug use is the riskiest way.
Yeah, it's the riskiest way because it's a direct blood-to-blood contact.
With someone who has HIV. We always point that
out. Please.
One of those people has to have HIV.
Very good point.
Someone with HIV has to share a needle with someone who doesn't have HIV.
Right. But in this area, we don't have a lot of injective drug users. We do have some, but just not a lot. Injective drugs really isn't a big drug around here. But we also have to look on the flip side of the coin. There's people inject drugs for different reasons. You know, they could be injecting drugs with insulin, for insulin use. You know, they could be sharing steroids. You know, a softball team or a football team. You know, and they wouldn't think of their family or their team members is having HIV. You know, so that's something that we try to get across in our prevention message also. It's any needles going into your skin, do not share them.
So what about drugs that you're not injecting? Does that put you at risk for HIV?
Sure. There's different drugs that you have to smoke. Some of them you use a metal pipe, and those can burn your lips, causing sores on your lips. And if, say, I was smoking a metal pipe and passed it to Terry and he smoked it, I could have blood on that pipe and he could burn his lip, and that would be a blood-to-blood contact. Also with other drugs like cocaine and crystal meth, you have this constant gnawing effect where you almost gnaw on the inside of your mouth, where it creates mouth sores. And kissing another person that may have dental problems or mouth sores themselves, it's another blood-to-blood contact. And just the effects of certain drugs, you know, crystal meth heightens sexual activity in people so that they want to have sex more, and they're not really thinking about it. They're just, I'm trying to find sex. So they'll find sex anywhere they can.
And they're not thinking about safer sex or just thinking about sex.
So those inhibitions that are infamous for people who have drunk too much or done drugs that put them in a different mood or situation to where they might be a little more vulnerable to doing things they wouldn't normally do.
Definitely. And some drugs put you in such a euphoric state that you're just like, you know, oh, just love me, you know. I love everyone, so what, you know.
So we've got to, so it's not just injecting drug use that we have to be careful about. We have to be careful about anything that's going to reduce our inhibitions and change our behaviors, because it's really all about us. That's what I've been hearing you all say. It's all about us. And so with that, with HIV, what about STDs? And does that, I mean, I know that we get a lot of the STDs the same way you get HIV. HIV is an STD. And so what does that increase your risk? Does that hinder? Is that separate from, you know, like if you have an STD, how does that affect the chances of you getting HIV if you have an STD or
if you have an STD, that's going to increase your chances of getting HIV, because most STDs cause a sore or an open wound of some kind, and that's another entry point for HIV. So HIV is looking for membranes, looking for open cuts or sores, easy places to get into the body. And if you have an STD like herpes, leaves little blisters, then that's another point of entry for HIV to get into. So it can kind of increase your risk of getting HIV. Most studies the CDC has shows that people with an STD are at a heightened risk of getting HIV also. And the reverse is true. If you are already HIV positive, then your immune system's weakened, you're more likely to get other STDs.
Okay. And so we need to be careful. STDs is a red flag.
Right.
And, you know, as HIV. So we, all of those things that can cause you to get pregnant can cause you to get an STD or HIV. And hepatitis is a big one in the news. And I know you said that about 1 million in population are infected in the United States with HIV. Do you know what that number is for hepatitis?
Isn't it like 4 million?
I think it is 4 million. So to me, that's saying that hepatitis is easier to contract. Is that true? I mean, I'm making that assumption.
And hepatitis C is a lot easier to contract in a lot of ways than HIV. We said that HIV doesn't like the air. So if I had HIV and I cut my arm and blood spilled out on the floor, HIV would only live in that blood maybe 3 minutes. But HIV will live as long as the blood or any trace of the blood is there. The blood could even dry up, but if it got wet again, then the hepatitis C in that blood could still infect someone, whereas the HIV only has, you know, 30 seconds to a minute, and then it's not a risk. But so hepatitis C is actually more contagious that way because it doesn't mind the air.
And I know you have, like, the most common forms of hepatitis are A, B, and C.
Correct.
And I know each one of them are spread in different ways. And you talked about hepatitis C first, so let's just talk about how it's spread. You talked about blood. Is that how hepatitis C is spread?
Blood to blood contact.
Blood to blood. And so that's needles. How else?
Needles are the most common way that hepatitis C can be spread. It can be spread through sex, but it's blood through sex. So it would have to be a blood-to-blood contact during sex.
So always blood to blood. It's not those other bodily fluids that we talked about with HIV.
Right.
But there is a hepatitis that is spread through those same bodily fluids. Do you know which one that is?
It's B.
Hepatitis B.
Correct.
So hepatitis B is spread from the same bodily fluids. Plus, I think urine. Is also included in that. And I know that we've done a great job of prevention with hepatitis B just because there's a vaccine, and we now require anyone 18 years or younger to be vaccinated.
Definitely.
And so would your message to the community be, if you're over 18 years of age and you've never received a Hep B vaccine, then it would be good to go see your doctor.
Yeah, definitely.
Get a vaccine.
Okay.
If you work with the public, actually, your employer might even offer.
Oh, okay.
Might even have a program where they would offer.
I know we do that at the clinic. We do hepatitis A and B together.
Right.
But if you've already had B, then you could do A. And then how is A spread?
A is the easiest one to spread because it's spread through kind of like unclean food or unclean hands. It's one of those things. It's one of the reasons why they promote washing your hands in the bathroom and always promoting good cleanliness.
Careful about doorknobs and things like that it can hang on to. And
it's spread more through fecal matter.
And I guess that's why it's more common in children.
Definitely.
But there is a vaccine for that as well.
Right, and you can actually, A is the one when you get hepatitis A, then you're really sick. Then when you get over it, you're gonna get over it. B and C and the other hepatitis, they don't go away like that. You've still got the virus.
And so C, we talked about vaccines for A and B. Is there a vaccine for C?
Unfortunately, there's not a vaccine. There's a treatment for C. It's very, very costly and very, very caustic on the body. And unfortunately, in our area, there's not a lot of choices for people with hepatitis C. At Heartland Cares, we're trying to involve more to be able to treat STDs and including the hepatitis. But right now, your only choice is your doctor or the ER, if you need treatment.
Which is really scary because people who we said it was spread the easiest through injecting needles. But that's the largest category of people who are not going to have access to insurance or other ways to pay to get the test or to get the treatment. So you've got all these people, in a rural area like this that are infected with hepatitis C and have no way even to find out for sure if they have it or to get treated for it. Because unless you have insurance or you can go to the ER, then you don't have very many options. We have people all the time who come to get an HIV test and they're like, I want to get a Hep C test too. And we can't do that. We can only test for HIV.
Okay.
So.
And so hepatitis C, there isn't a vaccine.
Right.
Is it a virus? Hepatitis, is that a virus? And so then we have, hepatitis is a virus, and then we have herpes is a virus, and genital warts is a virus.
Correct.
And as with HIV, and we talked about HIV being asymptomatic. So what about some of these other STDs being asymptomatic too? Is that the same with them because they're a virus?
In the way that until they show up, you don't know that you have it. Like herpes, until the blisters show up, you don't know that you're infected with herpes. You may feel fine, or you may feel kind of.
So there's not a test. It's
right.
It's a visual exam.
Right. Until you would come in and you'd have a visual examination and you would see the blisters and the doctor would say you have a herpes infection. But there's not a test you can go. People are always coming in saying, I want to get checked for everything. Check me for everything. Well,
I've
there's
gotten
not
the
a
nerve
test for
to come
everything.
in now.
There's not a test for everything. So you have to wait for some of them. Or there might be a test, but it's really expensive. So unless you're going to be willing to go to a doctor or somewhere to pay or have insurance to pay for the test, like you can't even go to the health department and get checked for everything because they can't afford to check you for everything. Herpes, syphilis, some of those, they're going to wait for symptoms. They're going to ask you about symptoms.
Okay. That's kind of scary. I guess I heard that with hepatitis C that we're seeing a big outbreak now because some people have been affected back, you know, when I was a teenager in the 60s and 70s, and it's been asymptomatic for that long.
Okay.
And now because of age or whatever, or different illnesses, it's becoming symptomatic. And so people who are having outbreaks may not have gotten it right now, just like people who've had outbreaks with herpes. Maybe they didn't get it now, maybe they got it 10 years ago, 20 years ago, 30 years ago.
Sure.
So, you know, it's like you got to almost look back at all of your behaviors, and that's kind of scary.
And when people tend to automatically look back at the last person they had a risk with, and that doesn't mean that's the person that gave any of that to you, because you know, just because it popped up today and that happened yesterday doesn't mean that yesterday is how you got this.
Wow.
You know, it could have happened a month ago, 2 months ago. It just depends on how long it's taken your
ago.
body to react to it and to show up.
You know, and we never turn, I know this is kind of aside from the hepatitis, but we never turn anyone down that comes in for an HIV test, because one time I was doing the test and there was a lady that looked like she didn't need a test. She was in her late age.
Stereotyping.
You know, yeah, very stereotyping. She was an older lady. I was at a women's health fair where I was getting a lot of older women that were coming. But you know, when we got talking about risk factors and stuff, she had worked at an actual dentist's office when she was young, and they didn't use any type of protection. And then when the HIV scare came out, you know, they still didn't use protection because they said it's not here. You know, it's not here, and we're not affected. You know, so she was a perfect candidate because she said she had blood splashed in her face and her eyes. You know, that blood to the membrane. You know, so you know, it's things that you've done in your youth can come back to haunt you, honestly.
So really, the message is, it's all up to you. You're in charge of your body.
Right.
You're the only one who has any control over what you choose to do, and being educated, as you stated in the beginning of the show, how important education is. And I hope we've provided some of that education here. I think that's important. Knowing your status, getting a test. Now, if I wanted to get a test, but I still wasn't comfortable coming through those doors at Heartland Cares, you know, on 619 North 30th Street. Could I call and have y'all come to my house and give a test, or come to a neutral place and give a test? Or
we try to discourage coming to people's houses just because of you know, different risks nowadays. We normally try to meet someone.
So
in
you
a
would
public
meet them
place.
someplace?
Yes, we would definitely meet somebody. They could call and ask if there's any like health fairs that we're going to, and they could show up to one of those. But yes, we would meet you.
So you have some options.
Yeah, we'd meet them.
We'd work out something.
Yeah, definitely.
Well, we are out of time, and I've just got so many more questions, and I'm sure the audience does too. So what I'd like to say is that we've got plenty of information at the clinic. You can call, or you can come by and pick up educational information. We have some experts to help with any questions you might have, and I hope this has been helpful. And thank you for viewing. Thank you all very much.
Thank you.